We're talking about people living with HIV, living long and better lives. And this cannot be achieved if we don't have social protection in the agenda. And this is also the moment where the global community is discussing and member states are discussing the new development goals, the sustainable development goals, the world's gonna look like after the MDGs era is finished. So put in social protection, and then we need data, we need research, and we need methodology like this study here has shown. We need these good practices, good data coming out, so that we strengthen our arguments. Why, we won't achieve the end of the AIDS epidemic if we don't have social protection on our agenda.
There's been an immense focus on universal access to healthcare, and that's really important, and we need to sustain that momentum. What this report shows is there's an equal need for universal access to social protection to ensure that people don't fall into poverty or kept in poverty as a result of financial or health crisis. And this report really illustrates the difficulty many people have accessing social protection and the role that stigma and discrimination continue to play. So it really sets a pathway for us to focus on reducing stigma, reducing discrimination, and increasing inclusion and access.
What comes out strongly from the results of the study is that, number one, while it's important to have mechanisms in place to provide economic social support to people living with HIV in the workplace, that's not enough in and of itself. There has to be more action towards people becoming aware of those programs. I think people in the workplace, regardless of whether they have HIV or not, knowing about them so that that stigma can be decreased, and the involvement of the recipients, of people living with HIV themselves, in designing the programs, helping people access them, and delivering them.
20 years ago, a meeting at ILO would have been about employers putting in place decent burial programs and giving people time off to bury their dead. Now we are not only looking at the fact that social protection for people is a reality, and especially social protection for those who are actually living longer with HIV. And that's not just now the West and the North of this world, it's actually happening in Africa. So that's one shift in the paradigm. The other shift in the paradigm is that 20 years ago, this is a piece of research that would have been done to people living with HIV. Now it has actually become a piece of work that is being done with people living with HIV. So truly, in terms of GEPA, the greater involvement of people living with HIV, it is a mark of how we are involved and seen and able to be actors in the response, equal at the table, rather than passive recipients of care.